concierge medicine, you know. And for certain people, that's going to be an interesting way to go. You know, we're just going to pull out, and we're just going to go to somebody who was like, you know, I'm old enough to know there was a general practitioner who actually came to my home, you know, when I was sick. You know, who actually, you didn't go to them, they came to you with this little black bag, you know, and of course you cried the minute you saw him because you know you were going to get a needle because everything was penicillin. I mean, whatever was wrong with you, here's a shot. You know, we're going to make sure that you get better by tomorrow. But it seems to, everything old is new again. I mean, maybe it's going to go back to that kind of delivery system where it's going to be, you're my doctor. I don't, you know, you take care of me for everything I have. I mean, you know, that's it.
So sometimes innovation can...
Trust me, everything old is new again. Don't ever throw concepts away. I mean, you know, they serve their purpose, you know, cultures move on, time changes, so always do look in 360.
Yeah, two comments to that, because I think Nick is right about that. But one example is CMS right now, when they're looking at states to give them Medicaid waivers. And New York is supposed to get $8 billion over 5 years for a Medicaid waiver. And the definition to get these waivers is you have to have a transformative process.
Who's defining transformative?
Well, they're letting, first of all, they're looking at regionalization. So you can't go in by yourself. It has to be a regional plan. Right now, Texas, California, New Jersey has the waivers. And again, no data is in yet. But each region, each state creates their own. And then their outcomes are then measured by CMS to see if things are being accomplished. So that's one way. Whether it's going to work or not, I don't know, but that's finally thinking out of the box. So one of the things that we have committed to is to reduce our admissions by 25% over a 5-year period. Readmissions over a 5-year period. So that's one example. What Nick was talking about in terms of doctors visiting, or I prefer to look at healthcare teams now, who may be visiting patients at home, we're doing that in our communities right now. And one of the things that we're doing is teaching the population healthcare aids for people who can't get out of their houses. And again, we're trying to work on the video concept so that once our teams are in the house, you can have a doctor take a look and see what's going on eye to eye. So I think some of those things are going full circle.